Good day to everyone again. Welcome back. This is Dr. Wilson-King of Victory Rejuvenation Center. Today's video is going to look at THC, testosterone, and opioids. What a great combination, huh? Well, not really. We're going to share some things with you today. I recently participated as a speaker at the Society of Cannabis Clinicians inaugural conference in September of 2023. I was asked a question from the audience about THC, testosterone, and opioid suppression. The question posed by this clinician is a very good one. He was using cannabis, including THC, as he weans his patients off of opioids, and he wondered if the treatment for the opioid addiction was also affecting the testosterone levels. It's a very good question. There have been studies that have actually looked at THC, CBD, and the combination of the two and their impact on the steroidogenic function and the germ cell lineage of the human adult testicles. They did things where they exposed the testicles to CBD, THC, a combination of CBD and THC for like a 9-day period or such. And there were other studies done too. There were no adverse effects ascertained, such as there was no impact on testosterone production, the overall tissue morphology, meaning the shape and the findings in the tissue, and the number of proliferating cells or genes that encode the proteins involved in the Sertoli and Leydig cell functions, the cells that make testosterone. The function did not change. Let's look at the role of the endocannabinoid system in this situation. The endocannabinoid system is a key modulator for reproductive functions in males and females. Most, if not all, the molecular components of the endocannabinoid system are present in the male reproductive system and female. Endocannabinoids can inhibit some of the hormones along the hypothalamic, pituitary, and gonadal, meaning ovary and testicular, axis, that whole chain of organs there. Cannabis's impact on male fertility is more related to the semen parameters and doesn't seem to affect testosterone levels. Cannabis has been reported to reduce sperm count and concentration, induce abnormalities in sperm morphology, meaning the shape of the sperm is different than the normal functioning sperm. Cannabis can reduce sperm motility and viability and inhibit capacitation. Capacitation is the process that enables the sperm to penetrate the oocyte for fertilization. Subsequent studies have shown that these changes apparently don't affect fertility. A study in 2018, based on findings from the National Survey of Family Growth, found that there were no statistically significant difference on the impact of cannabis use on the time to conceive a baby. They compared over 1,000 cannabis-using couples to over 1,000 non-cannabis-using couples and measured their time to pregnancy and found that there was no significant difference in the time to pregnancy for either group. So how does someone treat testosterone suppression while weaning off opioids and initiating other therapies, including cannabis? Treating hypogonadism, that's low testosterone or testosterone deficiency, is best managed based on the patient's age. That's because age determines who will or won't respond well to certain treatment methods. People assigned male at birth under the age of 40 can increase their testosterone levels by stimulating the actions of the Sertoli or Leydig cells, the cells that make the testosterone. And one can do this by using a medication called Clomid or HCG. HCG is human chorionic gonadotropin, which these days is quite difficult to find and may be quite expensive. So Clomid is an easy oral method to use. However, patients 50 and older are probably do better with testosterone. You can try to treat over 50-year-old with Clomid or HCG, but generally they don't respond very well to that. Now, you say, okay, under 40, you can use Clomid or HCG. Over 50, you probably need to use testosterone. Well, but what about the 40 to 50 years of age? I suggest you try Clomid or HCG and see if that works. And if it doesn't, then testosterone can always be used. Testosterone use suppresses the male's ability to make their own testosterone. So you want to hold off on testosterone for as long as you can, but if you need to use it, please use it, because hypogonadism or testosterone deficiency in men is quite debilitating, as I repeat myself. But I want to drill home this message, because I understand the position of the healthcare professional who asked this question, and other healthcare professionals who find themselves faced with a patient who is tired of feeling unwell and looks to them for solutions. My best advice is to be open and transparent about the treatment options and let the patient make an informed decision. We all want optimal well-being, and understanding the relationship of cannabis and hormones and other therapies is really important. Please remember to share, like, and subscribe below. Don't forget to check out our website. You can sign up for our monthly newsletter on the site and see all the other wonderful things we have. Thank you.